So I think we're ready to go to start the meeting. Good morning, Ghana, Uganda, Nigeria, Zambia, the host Malawi, and the South Learning Network Secretariat here present. Welcome to your link and learn on demand creation for condoms hosted by Malawi. I'm Dr. Andrina Mwansambo, the head of HIV prevention and management at the Malawi National AIDS Commission, and I will be your host and facilitator this morning. But before we commence our meeting, let us know each other through self-introductions. I know people are writing in the chat, but then those who are already online, they can quickly raise their hand and introduce themselves. And actually, we can start with Ghana. Quickly introduce yourself. And then after Ghana, they need to be Uganda. And I've noticed Nigeria is not there yet, but if they have connected, they can introduce themselves. And then Zambia, then Malawi, the host, and finally the secretariat, the South Learning Network Secretariat. Over.
Thank you.
Hello? We have lost you. Hello? I don't know whether it's my network or your network.
You mean me?
Yes.
So should I introduce myself again? I'm Jane Okra from Ghana.
Okay,
Ghana.
thank you. Thank you. I lost you, I couldn't hear you. Thank you, welcome to the meeting.
Thank you.
Anyone from Ghana to introduce themselves to?
I'm sure they'll join later. I'm sure they are joining.
Okay, thank you so much that Ghana is there. Can we hear from Uganda? If there's anyone from Uganda, can you introduce yourself? Uganda?
Good morning, colleagues. Rosemary Chindiomunda, UNFPA Uganda office.
Okay, thank you. Anyone else from Uganda?
Good morning, colleagues. Dr. Peter Mdiope. I coordinate HIV prevention in the Ministry of Health, Uganda. Thank you.
Okay, thank you so much. Anyone else from Uganda?
Good morning. Dr. Komiljan Ahmedov. I'm a fast track advisor at UNAIDS office.
Okay. Anyone else from Uganda, or we are done with Uganda? It seems we are done with Uganda. Anyone who has joined from Nigeria or not yet?
Yes, good morning, Adriana, and good morning, colleagues. Richard Amenya is my name. I'm in the Nigerian office for UNAIDS. I'm the fast track advisor. I'm sure the rest of my team will join later. Thank you so much.
Thank you so much, Nigeria. And now Zambia. Anyone from Zambia?
Good morning, everyone. Martin from Zambia here. I'm sure my colleagues will be joining soon.
Okay, thank you so much. And on our fellow host, Malawi, can you just introduce yourself, the ones who are here on the meeting?
Good morning. I'm James Njobvuyalema from Malawi National AIDS Commission. I'm one of the condom champions. Thank you.
Good morning. I'm Philip Mkandawire, working with PSI Malawi as the head of marketing and research. Thank you.
Anyone from Malawi or other colleagues will be joining us later? Okay. Now,
Washington.
Okay, Washington?
May join us in another meeting at the Ministry of Health headquarters. Washington from the Ministry of Health.
Okay, so he will join us later. Okay, just to mention that we have two condom champions in Malawi. One is James Njobvuyalema, who has just introduced himself, and the other one is Washington Ozito Sauka, who is in another meeting but will join us later. So we have 2 condom champions, one from the Ministry of Health and one from the National AIDS Commission. Now we'll end with the South to South Learning Network Secretariat. Quickly introduce yourself.
Thank you, Dr. Mwansambo. So my name is Kiri. I'm the Program Director for the South South Learning Network. Perhaps Lulama, then Yani, then Saul can quickly introduce yourselves. Thank you.
Good morning, colleagues. My name is Lulama. I'm also part of the South South Learning Network team based in Johannesburg.
Thank you.
Morning, everyone. I'm Yani Swart. I'm also part of the SSLN team here at Genesis in Johannesburg.
Hi, everybody. Good to meet everybody. My name is Saul Johnson. I head up the health practice at Genesis Analytics.
Thank you. Was they the last one? Is it somebody else?
That's the full team currently here.
That's a full team. Great. Okay, thank you so much. I'm excited to note all the countries are here, they're represented, and other colleagues will be joining us later. I've noticed Ghana is here, Uganda is here, Nigeria is here, Zambia is here, and of course the host Malawi, and of course the Secretariat. I'm very excited now. We can start the meeting. We'll start by mentioning what the purpose and objectives of this intercountry link and learn session. Basically, this is to facilitate learning exchanges, as it is a powerful way of disseminating promising practices in one setting and adapt, replicate, or scale up successful interventions in different settings across countries. So these intercountry link and learn sessions will serve to provide a platform for countries to engage with peer countries to find solutions for challenges arising from implementation of their condom or KP programs. So these sessions will focus on specific programmatic issues and will provide the platform for facilitated conversations and discussions for joint solutioning on the identified issues. So on behalf of the Malawi team, who are hosting this first link and learn session, I would like to welcome you all to this session on condom demand creation. Thank you for availing yourself for this important meeting. I know it's not easy, there are so many meetings happening, but your presence here just shows your commitment and the dedication you have to this South to South Learning Network processes. I would also like to thank the South to South Learning Network Secretariat for organizing this meeting. I know it hasn't been easy because we are all over the place, we are busy, but you've managed to pull us together and to have this meeting. So well done, and you need to be recognized and commended for that. As you might recall, during the inception phase of the South to South Learning Network, countries completed an assessment for condom and key population programs using the HIV Prevention Self-Assessment Tool, in short, PSAT. The PSAT is a tool used by countries to reflect on and comprehensively assess their own HIV prevention programs. The assessment provided an overview of country programs and highlighted areas of strength as well as areas of improvement. Then now, from these assessments, the South Learning Network Secretariat team was able to identify the topical intercountry link and learn sessions. And based on the strengths, countries were selected to host these sessions. And based on areas of improvement, countries that could benefit from these sessions were also identified. Malawi was selected to host this session today based on our strength in demand creation for condoms. We therefore hope that our presentation will help trigger more discussions, and we're looking forward to learning more innovative ideas from your countries, because even us, there's still a lot of areas, things that we still need to learn from you, other countries. And quickly, just to mention what are the expected outcomes of this meeting, it is expected that countries will find a safe space to discuss programmatic challenges in detail, listen to the experiences of peer countries and discuss solutions to these challenges, identify key next steps to address the programmatic challenges in their context. So let us therefore feel free to deliberate on the issues and also actively participate in the discussions. Thank you all for your kind attention. Now, maybe quickly, I don't know whether the secretary has the agenda to quickly beam it so that member countries are clear what the agenda is. And as you can see, we have already done the opening, the welcome and the opening. So our agenda is basically to have 2 presentations. That is, they'll be in 2 parts. There'll be part 1, where we'll be looking at the why and the what in terms of promising practice activities for condom programming in Malawi. And the part 2 will be on the how. And each presentation will take about 15 minutes. And the first presentation will be presented by someone from the national level program, while the part 2 will be presented by somebody from an implementer. And thereafter, we'll have open discussions where we'll need to reflect on the presentations and deliberate on the key issues and see how we can apply the lessons learned practically. And then finally, we'll all look at the summary of the commitments and next steps where participating countries here, which is Ghana, Uganda, Nigeria, Zambia, will share their own takeaways from this presentation. I think in a nutshell, this is our program for today, and this should take us to about 1.5 hours. So we'll see if we will really try to work within that time. Unless if there's any other issues, can I take it that the agenda is adopted and we can quickly move into the presentation? Okay. Thank you so much. I think at this point, yeah, I can see from King Martin said, yes, agenda adopted, great. So we can now proceed to the presentation, and allow me to invite James Njobvuyalema, who is a condom champion for Malawi, and he's a HIV prevention and management officer at National AIDS Commission, and is the focal person and also champion for condoms. So over to you, James. Take us through part 1, promising practice presentation, the way and the what, where we'll cover the contextual overview of HIV and condom program in Malawi, key evidence or factors that informed the activities or campaign, and description of interventions and of campaigns. Over to you.
Thanks, Dr. Mwansambo. And welcome to our presentation. As the chair has already said, I'll do the first part, and then Philip from PSAT will do the rest of the slides. Thanks. Yeah, just to give the contextual overview of the HIV and condom programming in Malawi. Malawi is approaching epidemic control levels with latest estimates. These estimates were for 2019 using Spectra. But the latest estimates that have been done for 2021 Spectra has shown that we have done far beyond this that was reported. And for women, so above 94 for the testing, 95 for enrollment to treatment, and 95% on the virus suppression. These are just estimates that have just been released, but this presentation was based on the 2019 estimate. And even for men, it's over 90 for all the 3 targets. So we are doing fine in terms of treatment and the virus suppression. In terms of new HIV infection, we reported that it has reduced by 40%, but for latest estimates, it's far beyond this, and with this we are around 32,000, but now it's below 20,000. So we are doing fine in terms of prevention, but still we have gaps to be addressed. So despite declining incidence, effective HIV prevention interventions such as comprehensive condom programming need to be accelerated to sustain the gains achieved. So condom programming is our key intervention even in our national strategic plan for HIV and AIDS, and even our prevention strategy. In terms of condom use, this was 2015. It was 75% women, 75% men, and 50% women. But if you can do the Malawi demographic survey today, it will be far beyond this. But now, because this is the data that we have, we are at 75% men and 50% women, which is a big gap. So there's a projected study need for, go back. There's a projected study need for condoms in Malawi, as you can see the graph at the right hand. As the years go, this the condom needs for Malawi is rising. For 2019, 2021, it's 103 million. As you can see, as we go 2023, it's rising. But we have heavy reliance on the public sector free condoms. So these public sector free condoms are the ones that are procured through the Global Fund and other donors. Now, as you can see, 68% relies on those free condoms, donor funding, and 2%, only 2% commercial, and 30% social marketing. So what we are saying is, if you can increase the market in terms of the proportions, and we have the 2% increased and also the 30% increased, so that because as it is now, if the donors just increase their money, it means in terms of condom availability, it will be a problem because people are used to the free condoms. Next slide, please. So, in view of this, as a country program, we have developed a communication strategy for condoms, and also a strategy for last mile condom distribution. So, the key evidence or factors that inform the activities or the strategies in that document. These are we have the back of condom programming investment going to supply and distribution. If you analyze our funding for condoms, allocation of money for condoms in the NSP or other or global funds grants, you see that the big part of it is going to supply and distribution. Little is on social behavior change and communication. So this is one of the gaps that we want to strengthen, and then that's why we developed the strategy to address some of these gaps. We need to do more social and behavior change communication activities so that condom demand, condom use should be high. Condom demand is stagnant among key and private populations. So I also want to increase demand for condoms in this population. And also, use is high, specific subpopulation groups require tailored interventions. Like we have tried to segregate the interventions and tailor-made to different populations for HYW, for female sex workers, for men having sex with men. We have specific interventions, not all sides fits all. So this is what we have done. So a review of condom communication efforts in Malawi revealed a number of things. First, clarity of condom messages and content has been weak over the past decade. So we need messages that are very clear, and that's what we have done in the new communication strategy. And also, there wasn't much innovation in terms of our messaging, but now we have tried to address this problem. And also, as you know, social media is just growing, and it has a large audience, in terms, especially the youth. So we want to also use social media platform for messaging of condoms. Next slide. So in terms of the description of the interventions, these are the target populations. Men in high-risk geographical and occupational settings. There are some occupational settings that are higher, where the risk is higher than the others, like the estate workers. The risk of HIV transmission is high in those settings. We have the truck drivers, even the informal sector, where we have small businesses, people doing taxi business, using bicycles, the taxi business, and other population that previously we didn't have targeted interventions, but now we have done the targeting. There are other main like populations. As I said, this also we have tried to develop special messages targeting these groups. Adolescent girls and young women in high prevalence geographical areas. We have also special messages for this. If you look at our HIV prevalence, even incidence, it's higher in the urban population than the general population. The districts that have cities and the urban areas, that's where we have a high HIV prevalence as well as incidence. So adolescent girls in these settings, they have their own targeted messages. Men in concurrent partnerships. So in terms of desired behavioral outcomes, we want to improve the level of knowledge and information among vulnerable groups, influence positive attitudes towards condom use, and also to influence positive practices on consistent condom use. Our demographic health survey 2016 showed that there was inconsistent in terms of condom use in all population groups. And also to promote messaging consistent in condoms. Promotion and marketing. I think this area we haven't done much, and this time we have included interventions that will specifically address this problem. So that's the overview, and my colleague will present the details. So, Chair, let me hand over to you, and my friend will, for you to invite my friend to continue. Thank you.
Thank you so much. Thank you so much, James, for presenting on part one. And member countries, if you have any questions and observations or comments, you can also be putting them in the chat box. At this moment, allow me to invite Philip Mkandawire. This is from an implementer, and actually is from Population Services International, which is one of the key implementers of condom program in Malawi. Over to you, Philip, to take over part two of the presentation. And I know we have eaten up much of the time, so try to be as quick as you can, so that you can maybe do is 10 minutes, or if 10 to 15 minutes. Over to you.
Thank you, Dr. Mwansambo. Yes, I'll try to really quickly share the presentations. So I'll give an overview of the intervention in terms of what we've done to help promote condom use. So just like in any campaign, any communication campaign, you need to have underlying models you're trying to really follow. So for this condomized campaign, we are mostly using the socio-ecological model and the stages of change model. So I'll quickly talk about this. When you look at the socio-ecological model, we understand that behavior change is influenced at different layers. We're looking at the individual level, we're looking at the community level, but also looking at the bigger picture, whereby we're looking at factors to do with the community, factors to do with the enabling environment, and also factors which can affect adoption of the behavior at an individual level. So you can see the different layers. We have to mirror them, get to understand better what is happening at each level as we're coming up with the campaign. But also we try to understand the individual in terms of the journey they make as they're trying to really adopt the behavior. So we use the stages of change model, whereby we know for sure the first stage is for somebody, they're still in the pre-contemplation stage, trying to say, okay, is it important for me to be using a condom or not? The contemplation, okay, the determination, the level where they are trying to do the actual action. And you are aware of issues whereby inconsistencies in the decision. One will say, okay, fine, I use a condom with this partner, I don't use with the condom with another partner. We had to consider all those factors, the maintenance level, how do we ensure that at least we promote the maintenance, the consistency part in terms of condom use, and also the recurrence stage. So basically it was like, we had to understand, have a holistic understanding of the individual and the factors that influence the condom use decision in the campaign. Next slide. Yes, so as we're trying to do that, in trying to understand the individual, but also we came up with a behavior matrix. And the one which is being highlighted is just an example of a behavior matrix. My colleague James talked about men in concurrent partnerships as one of the target audience. So we, after like a detailed understanding of the current behavior for men, what really is happening with regard to concurrent partnerships, we also have to map out the desired behavior and also the barriers to the desired behavior. What are the key influences? And that helped us to come up with the communication objectives. So you can see the different columns within the table highlighting that. For example, we're looking at current behavior. A lot of men have multiple concurrent sexual partners. That's coming out. It's more like the in thing now. Most of the men partners with whom they share an emotional bond or long-term relationship, and men partners that play different roles in their lives. It's different types of partnerships. Condom use is not consistent in most of these setups. But also there's use of condoms less frequently, if at all, with some partners, like they decide who to use the condom with. They do their own self-evaluation. And we're trying to promote consistent condom use. The barriers to this are to do with social stigma associated with condom use. For example, the perception that condoms are for those who are promiscuous. For example, even having an access to a condom, buying a condom, some people are like, okay, the society will consider somebody to be really like somebody who is promiscuous, but the belief that condom use decreases sexual pressure. These are things which were there in the past, but we thought we would address them, but they're still there. There are some societies, groups of people who still have such kind of beliefs. Gender and cultural norms which reinforce masculine stereotypes. For example, women waiting for the man to make a decision to say he's the one who has to make a decision whether we use a condom or not. So men taking advantage of that, and depending on whatever they want, they may not really like encourage within the relationship the use of condoms. Role perception is also something which we noted. The key influences, we noted that sexual partners within the campaign, as we're promoting condom use, are a key influencer. With the campaign, we need to target, ensure, come up with messages which can also really like encourage that partner kind of negotiation, the negotiation skills, the discussion, so that at least there's no need to use condoms. Peers, but also religious readers, the religious setup. The discussion about condom use should be really like be done in such kind of setups as well, so that at least we're not encouraging promiscuity, but also ensure that at least people listen to such kind of groups, and it depends on how we really like coin the messages. We came up with the objectives. I will not go through the objectives in detail, but we had to really come up with the objectives which will help condom use for men who are involved in concurrent partnerships. And when they say concurrent partnerships, I'm sure most of us are aware of that, having more than one partner. You have a wife, you have a girlfriend, you have all of them at the same time. And you may have, sometimes there are times whereby one is not using condoms with a girlfriend, but also there are times whereby have multiple girlfriends, and there are girlfriends where one is using condoms with, and there are others where one is not using condoms. So that's the behavior we're trying to address, and we're trying to really promote condom use. Next slide. Now, one thing which I wanted to share, which is unique, the other things are just like standard, but as we're trying to really understand the behavior, we had to really get a good understanding of the journey one takes. So in line with the stages of change, we did the journey mapping. So the journey mapping is a process where you get to understand and know exactly what to do at which point. So we mapped what we called an ideal journey. The ideal journey is mostly what most of us, those who are into programs implementation, think. For example, we'll say, this is what we want somebody who is into concurrent partnership to be doing in terms of condom use. We also mapped the actual journey. What exactly happens? And most of the times, the ideal and the actual is different. We're able to know the differences between the ideal and the actual. And that helped us in terms of areas of focus, but also mapped out the key influencers and the barriers and or even the motivators with regard to each stage of the journey. For example, we're able to tell for client X or like target group Y, maybe they are at awareness stage. In terms of awareness, what do we need to focus on? What's happening? What is our expectation in terms of the ideal journey, in terms of awareness? What is actually happening? Decision making, what is happening within the journey up to the advocacy level? So in terms of social behavior change, you may have someone who is really can act as an advocate. How best can we use, what messages can we come up with that which can help with advocacy? What messages can we just help with regard to uptake? And in trying to map the two, and I'm emphasizing on the ideal journey and the actual journey, it proves to be a powerful SBCC approach in terms of condom communication, because we are able to appreciate what is happening with the individual, which sometimes is different to what we're expecting as a program in terms of the country, in terms of what we expect in terms of condom use. Okay, next slide. So we mapped out that, and that helped us in terms of the decision, in terms of the messages we had to roll out. But also one thing we did was, for each target audience, we developed what are called archetypes, the profiles of the target audience. This was not like, through this, we had to gain insight into our target audience in order to identify what are the challenges and also the actual opportunities. Let me emphasize this. We had to understand the target audience as real people. There's a tendency to only look at the target audience by just focusing on the demographic descriptors. But when we're developing the communication strategy, we had to look at both demographic and psychographic factors, so that at least you have a 360 degrees understanding of the target audience. For example, the profile, we did some deep dive. And when I'm saying deep dive, we had to engage them, talk to them, get to understand the target audience so that we understand what behaviors, what opportunities are there as we're trying to promote condoms. For example, we're trying to understand who they are, what is their daily life like, so that it presents opportunities in terms of, okay, if we're promoting, where do they spend most of their time today? And what do we need to do? Okay? What are their hopes and dreams? What motivates them? What are the main challenges they face? In terms of general, but also in terms of condom use. What are the key influences? Who do they listen to? What media do they consume? When and how? That helped in terms of understanding the target audience. And it was easier when we're developing the campaign to say, okay, this target audience, this is where we can meet them. These are the daily challenges they are facing, general, but also pitching the condom use messages. Maybe as we're trying to understand the deep understanding, we're able to now relate to sort of, oh, well, in terms of condom use, this is where the challenge will be. This is what is happening with regard to condom use. And in the end, you find that we're able to really come up with well-tailored messages for the target audience. Next slide. So the target audience, like understanding, is something which we need to promote, like coming up with well-profiled archetypes. An example of a profile we came up with is a man we are calling Uncle Ben. And this is a name which came up from the interaction with target audience. Uncle Ben. He's a 39 years old, is married with 3 kids, lives in a peri-urban area. He has a wife and has a girlfriend. But also Uncle Ben owns a small business. His day starts early to open up the shop, followed by busy day serving customers. Over the weekend, he goes to a bar to watch football with friends. He meets his girlfriend after this. Normally over the weekend, that's when he has the time. He's using going to a bar to watch football as an excuse, and then he's able to also like meet the girlfriend. Meaning he's late home from work. He eats at home and has had many quarrels with wife for being raped. Just that kind of understanding, you find that we're able to pillar and get to understand he is a man, Uncle Ben. Uncle Ben, just like any other name. We're able to map out what are his dreams. For Uncle Ben, when we interact with them, they want to grow their business, wants to educate his children, wants to support his parents, to be an active member of the church. What are his challenges? The relationship with his wife can be tense. Okay, he's got high expenditure from his lifestyle. The business slowing down, is seasonal. What are his fears? Closure of business, end of marriage, impregnating a girlfriend. You can see some of the challenges were general about his life, but there's impregnating a girlfriend. What are some of the influences on behavior? Peers, exposure to women at his workplace, alcohol consumption, and the level of disposable income. The media consumption, we're able to know that Uncle Ben spends time on the social media, Facebook, WhatsApp. Football, he likes listening to news on the radio. What is Uncle Ben saying? Uncle Ben is seeing other men having multiple relationships at one time. So it's more like he's not, he's like most men are into this. And that also motivates him to say, okay, well, if I've got a girlfriend, I've got multiple partners, well, it's just being aligning to what others are doing. Lots of women during the day at the bar, he's seeing lots of women. Communications about condoms from brands and generic campaigns, like he's seeing more of like generic campaigns. It's like, I've seen this, I'm like, there's nothing new coming out. What is Uncle Ben hearing? A man with several women is a real man. Okay, that's what the society is telling him. Extramarital affairs are stress removers. And also everyone is doing it. Okay, what they think and feel. He's concerned about his public image and wants to be an influential member of the community. He's worried about success in business. He's worried about success in business, worried about maintaining his family. He's content about his wife, knowing about his affairs. What do they say and do? He frequents beer bars and interacts with peers. He says he loves his wife and family and has multiple partners at one time. So through this, we're able to understand who Uncle Ben is, and being able to say, okay, generic information about Uncle Ben, but also some of the opportunities we can use for the condomized campaign to address the condom use behavior for Uncle Ben. Next slide. Next slide. So in terms of the behavior, so we had to understand Uncle Ben, and now based on the understanding of Uncle Ben, we came up with a message matrix. So we had to realize the objective was to development of realistic perception of personal risk for HIV and other STIs and pregnancy. So we came up with stakeholders, came up with messages to do on how best we can promote condom use for Uncle Ben. People within the Uncle Ben kind of group. So I will not read through, but there were some interesting messages which, from the good understanding of Uncle Ben, which we thought can indeed push Uncle Ben to use condom. For example, Uncle Ben is afraid of impregnating the girlfriend. He is afraid of that responsibility of saying he's the one responsible for that because it will break his marriage. Uncle Ben realizes that you don't want MG2 to be pregnant. MG won't like it. So there were messages to do with that, and protected sex not only can breed another life, it can also breed HIV, hepatitis, and other STIs. And we came up with channels, tools, and approaches. For example, we had to look at the mass media promotion, low budget options, for example, radio, high budget options like the multimedia campaigns, billboards, and also looked at community interactions, the interpersonal coming in, the print, the provider job aids, which really speaks to Uncle Ben as our archetype, as our profile of the target audience, and using the different dimensions, being able to come up with messages which can talk to Uncle Ben. So we had to come up with the messages and also the channels, the tools, and the approaches which we use to really promote the different messages we came up for Uncle Ben. Next slide. Yep, so that was just an example. And through the process of developing the communication strategy, we had a number of stakeholders and they played different roles. For example, there was the Ministry of Health, the Health Education Unit. This is a unit which leads the coordination of health and promotion services. They were part of the process. Ministry of Health, DHA, colleagues like Washington, who is the condom champion, helped with was responsible for providing policy direction and technical guidance towards implementation of the Condoms campaign within the communication strategy. National AIDS Commission, the leadership we have here, with James, the condom champion, Dr. Mwansambo. These are people who are helping coordinate how best can we focus in terms of our condom communication. So NAC, as the umbrella body, acts as the secretariat in coordinating and managing the HIV and AIDS national effort in Malawi. So NAC is ensuring that condoms-based activities are done in a coordinated and participatory manner. An example of what is happening here, and also implementing partners like local and international NGOs, including networks and associations. We are invited to participate in the process of developing campaign, and they are able to support the demand creation of condom through the implementation of different social and behavior change communication activities. But also, we have to include different advocacy groups depending on their expertise and areas of focus. They are playing different roles in terms of how best we can promote condom use to the different target audience. So, focusing on Uncle Ben, we have so many even young people. We give them a name and we're able to know, okay, for example, this is Kondwani. Kondwani is a local name. Kondwani, a young boy. We know that, okay, for this message is tailor-made to Kondwani, depending on the challenges that Kondwani is facing. And next slide. So, for the campaign, in line with the different target audiences, in as much as we don't have clear outputs, but we've got clear targets. So for the different target audiences, we're able to really from other sources know the population size, and also for a period up to 2023, how that group will look like in terms of percent, but also the condom use estimate for each of the target audiences, and we're able to project with the campaign, where do we want to land at in 2023? You can see the figures, okay? For different target audiences, like 6 weekers, we want that is from the 75 to around 90% in terms of condom use, and also for the different. So the information we have from the profiling, the information we have from the insights we collected from the target audiences, helped us to really land at key messages which can help promote condom use. And in the end, we know for sure that at least the percentages would increase from the current point to another point, to the point we expect in 2023. Okay, next slide. What were the key challenges and also the learnings? Yes, in terms of as you all know, COVID-19 has affected a lot of mass and interpersonal condom promotion activities, because we, as a country, we plan for big kind of engagements with different target audiences. But I think we are all caught unaware with the COVID-19, and that also affected in terms of the level of engagement. But also, this presents quite a number of opportunities. We know COVID is here to stay with us. What this means that now in terms of condom promotion, there's now need, we're trying to now tap on the social media, because there's a lot of engagements within the social media with different groups. Even people in the rural areas, they are now on WhatsApp and they're coming up with them some of the intervention condom promotion initiative, for example, video clips with weather trade messages, posters, even which can at also be shared through such kind of platforms, and they will circulate and people will be able to get the messages. And the tendency of sharing information. Through that, we feel like we can take advantage of the current situation to also promote condom use through the Condomize campaign. But also, Yeah, so plans are underway to launch the virtual condomize campaign. So the virtual means to taking full advantage of the social media, so that at least we're able, the Facebook pages, the WhatsApp, the Instagram, and any other platform which is there, which has good following. We can take advantage of that and use that platform so that at least we promote the virtual condomize campaign. So quite a number of lessons learned along the way, but also the challenge is that the campaign has not been rolled out as expected just because of the challenges we had with the COVID-19. Because yes, we had to protect the lives of Malawians by avoiding the physical kind of gatherings, which we had initially planned. Next slide. Yep, I think this is what we wanted to share with the team to say, yes, we have a campaign which is well tailored to the needs of different population groups. What we've learned is one size fits for all may not work and will not work. We've learned the hard way in terms of social behavior change communication for condoms across the board in a number of countries. We need to now come up with well-tailored messages for different target audiences. And through this initiative, we want to really do that. So let me hand over to the chair for the discussion. Thank you. Over.
Thank you so much, Philip, for that comprehensive presentation. And as you noted, I couldn't stop you because I thought I needed to give you time to finish your presentation, because then the discussions will be around what you present. So thank you so much for presenting comprehensively. And now that we have the two presentations from Malawi, that is looking at the why, the what, and the how of condom programming and demand creation in Malawi. We would like to now open the floor for any observations and questions. And I've noticed that people, as we already requested, have already put some comments, questions in the chat box, which we'll respond to. And also let me take this opportunity to inform members who have just joined us, who joined us along the way, that they should register themselves in the chat box so that we know who they are and where they are from. So at this point, let me open the discussion. I know we're not doing very well on time, but we are hoping that we'll be able to discuss the key issues. Basically, at this point is would like you member countries that are participating to hear what are your reflections on the Malawi presentation. What surprised you? What impressed you? What is concerning you about the Malawi's approach? And as I've said, I've already seen some comments in the chat box, some of the concerns, and would like to hear from you, and so that we can discuss. And we have also noticed in the chat box some comments, some commendation for what Malawi is doing. So we've also taken note of that. And we need, in the discussion, we need also to look at what cross-country learning can be applied and how can we do it practically. And also what are some of the conversations that we now need to take place across countries, so that, or even within countries, so that we can advance the issue of condom programming. So at this point, I would like to open the floor for any raising of hands, in addition to the questions that are in the chat box. And my colleagues, James and also Philip, just take note of the issues in the chat box so that you can start responding to them. But some of them have already taken note of them. I can just read through them while we're waiting for people to raise hands, so that Philip and James can quickly respond to that. So basically, one of the questions is that what interventions, so James and Philip, just take note so that you can respond. What interventions have you implemented to strengthen condom documentation, especially at the last mile in the community? And the second one is, do Malawi have an information system for documenting condom consumption data for condoms distributed through the alternative distribution sector? And the other issue, Philip, I know you presented on the archetype. The issue is there's a comment that I hope Uncle Ben, I know it's like just a fake name, but then his picture was appearing there. So I hope he didn't mind that his picture was put there. I hope consent was sought from him to use his picture in the presentation. And also, just to mention that as we are talking about, we need to understand the issue of how you monitor the SBCC program to evaluate the effectiveness of the socio-ecological model and the stages of behavior change theory. So at the moment, maybe you can respond to those questions while we're getting some more questions, either through people raising hands or through the chat box. Over to you, James and Philip.
Yeah, thanks, Dr. Mwansambo. Let me start. Okay, James, go over.
Okay.
Go ahead.
Thank you, Chair. Let me take the first two on what interventions have you implemented to strengthen condom documentation, especially at the last mile in the community. Just to say that in terms of condom coordination at district level and community level, we have at a facility, every facility or district hospital or peripheral facilities, we have a focal person on condom programming. So this person is either a nurse, clinician, or environmental health person. And that person is responsible to gather information or data on condom use from different outlets. Let's say it's at facility, whether it's STI clinic, family planning clinic, youth-friendly SSLN corner, ART clinic, all those outlets. There's a person who gathers information from those outlets, and including the condom that goes into the community through the community-based distributing agents. It's this person that gets information. But in all the outlets, they also record condom distribution, the number of condoms that they have distributed. So it's this person now, the focal person, who reports through a form that we call logistic management information system, and it's uploaded in the DHIS2. That's how we collect data on condom use. And in terms of this information system, I think I've already said that. Distributed to the alternative distribution sector. In this case, alternative distribution sector may mean like maybe we have a DIC or what we call drop-in center. For example, female sex worker drop-in center. Or we are distributing through maybe an organization that is dealing with youth. This information also comes to the facility as a hub through the condom focal person. So the alternative distribution sectors, they are also given a form, condom monthly reporting form for condom, which they submit to the focal person and then consolidates for the whole districts and sends to the national level through the DHIS2. This is the system. I hope I've responded to the question. Thank you, Chair.
Okay, now Philip, can you tackle the other questions? And in addition to what you're gonna respond to, there's an additional, actually it's a concern, but also a recommendation that there's concern that in the Malawi presentation, there was an absence of attention to abstinence. And actually, it is true, there was nothing in the presentation to talk about abstinence. And the comments are going further to say religious leaders can be best helped to work on this abstinence issue. So, and in brief, it's like while we're working on condomizing campaigns, we need to also, we shouldn't underestimate abstinence too. So if you could also, as you are responding to the issues, can you also tackle on the issue of abstinence? Over to you.
Thanks, Dr. Mwansambo. Yeah, and thanks for these questions. I'll start with the consent for Uncle Ben. Yes, there's consent given by Uncle Ben as for us to use the picture, and also to really give the name and the picture, the Uncle Ben, the picture, the name of the one who, the owner of the picture is not necessarily Uncle Ben. So the picture and the name, we just have to combine them for the sake of it, but there's consent from the owner of the picture. In fact, for us to really use the picture, and there's really a signed agreement with the individual. So that's just like the way we do with most of them. People, we use either models for our materials, for the promotional materials. So yes, that is done. In terms of monitoring, yes, for any campaign, there's really need for good monitoring so that at least you're able to understand what is working, what is proving to be effective, and what needs to be changed. So normally there's this concept to do where we normally assess the reach against the actual conversion. So yes, the campaign can reach a number of people with messages, but how do we assess the conversion? So the conversion in this case would be like the uptake of condoms at different distribution points. What we've noted, like what James highlighted, there's good uptake in a number of setups. It's now just a matter of, the demand is there, the need is there, but maybe trying to just address some of the structural barriers. So I'd say we're doing a good job as we started with regard to promoting where one can access condoms, what the importance of using condoms, and all the the demand activities with condom use. And over time, we'll be monitoring in terms of using a proxy indicator to do with the consumption numbers, to do with the condoms at different distribution, which as a country we normally do. So it's just a matter of checking on that and see if there are like huge peaks in terms of what we are seeing from the numbers here. The other part is to do with the abstinence. Yes, you're right. Maybe in the presentation we didn't talk about the abstinence just because it was just a brief presentation, but focus is still on abstinence, and then those who cannot abstain are the ones we're encouraging that they should be able to like use condoms. But as you know, in terms of the landscape, yes, we're seeing people like the sexual debut age has gone down. In as much as we promote abstinence, but we realize that a lot of people, even young people, start engaging into sex at a very young age. So yes, abstinence is being promoted, but also in line with the condom use for those who decide to be sexually active. So yes, the campaign focuses on that as well. It's more like looking at a number of things. We're not just focusing on condoms, but also the other factors we need to consider, like abstinence is part of the package. I'm sure I've responded to the question. Thank you.
Okay, so Philip, thank you so much for those explanations and responses. There's some more that I would like you also to respond. I think the other one is for James, but then this one, let me already, since you're already having the floor, it says, how did Malawi achieve high condom use at last high risk sex, even when you were reporting weak SBCC prior to the campaign? And also the last one is with respect to female condom utilization compared to male condom, was there a difference? What messages resonated well to encourage female condom use, and what factors were addressed? Can you respond to these two? And then James, there's one for you which says, what is the level of resource investment, both technical and financial, into the campaign, and what is the source? I think Philip can also handle that if he can be able to do so. Over to you, Philip.
Thanks, Dr. Mwansambo. Yes, let me start by good numbers, but we are saying we have one weak SBCC. So it's just that as a country, we know we can do better. We are not necessarily saying that whatever in promotional activities which are there don't give us the results, but we know for sure we can do better. We can improve on the traditional ways of communicating. For example, with the opportunity that social media presents, in the past, we are not fully utilizing social media platforms. We feel like we can do it because, one, they've got a number of advantages. And also when you look at the cost implications with social media, the benefit of it, for example, you're able to transfer the cost to the one who is promoting the message. For example, if there's a WhatsApp message, The one who is sharing with others is the one bearing the cost. You do the initial investments and then off it goes. So we can improve on that, but also the quality. As we are all learning, there are quite a number of innovations in terms of visuals, in terms of the images. We can come up with good pictures and the like. All that to remain attractive, because what we are fighting for is that space in the mind of someone. There's a lot happening, so that at least the messages and whatever we're showing should really be attractive, so that it captures the attention of the individual. So when you're saying it's weak, we're just thinking a safe review shows that we can do better. But the good thing is we're still getting the numbers, meaning to say, okay, if we improve, we maintain those numbers, but also we can aim at higher numbers, as you've seen in terms of the projected 2023 estimates. So yes, we continuously enjoy improving in terms of what we're doing, so that at least we remain relevant to the needs of our target audience. Female condoms, yes, you're right. Male and female condoms, we came up with segmented messages. In fact, just because of limited time, we have a profile with somebody who is using a female condom, like an archetype as a profile describing everything. And we've got clear messages on how best to promote female condoms. For example, what we've learned with female condoms, most female condoms, IPC, interpersonal communication, is key. You can do mass to help with just the awareness and like, but at the decision-making point, IPC, interpersonal communication, is key, because as you know, there are quite a number of still myths and misconceptions to do with female condoms, which needs to be immediately addressed, so that at least one is able to use the condom, the female condom. So yes, the numbers for female condoms still struggling and the like, because uptake is, you can't compare with the male condoms, but I would say different approaches used, and we hope these will give us the intended results as we continue implementing them. The other question was what? Sorry, Dr. Mwansambo. The third one, if I've not responded all of them. Anything I've left out?
You have responded to the level of resource investment. Have you responded to that one?
Okay, no, the level of investment, yes. So
both technical and financial into the campaign, and what was the source?
Good. So yeah, not in terms of top of the mind figures, but I would say we, just as a country, there's support from different stakeholders. In terms of, let me start with the financial support to kick off. There's support from bilateral donors like USAID, pumping in some money to help with the Condomize campaign, working hand in hand with different actors within the space. In terms of the technical, I would say we have a vibrant social and behavior technical team within the country, with support from the leadership, let's say at Ministry of Health, either NAC, Department of HIV and AIDS, and even the Health Education Unit. There's a team which is responsible for reviewing the content. So developing a small team, for example, I belong to the team which looks at the content. We develop, we do formative assessments to come up with insights. We engage an agency to develop the materials, and there's a team which is responsible for reviewing. So a technical team which meets frequently to review the content of materials is there to guide on what to proceed with, or where you need to change. In terms of how much, I wouldn't talk about the monetary value, but I feel like it's a campaign which requires some significant amounts of resources to be invested, but something which is within the reasonable ranges. It's not so exorbitant, because when you look at use of social media, when you look at the print, and when you use like the TV, they are not that costly because we have tried to be so strategic. And also we are using mostly what the target audience highlighted as their media consumption sources of like the main sources of media consumption. So that we were so strategic to avoid the exorbitant channels to which would make the campaign so expensive. Thank you. I think in terms of details we can share with those who are interested in terms of the budgeting and everything. I think we should be able to have a chat with them so that they're able to understand the costing and everything. Thank you.
Okay, thank you so much, Philip, for those comprehensive responses. And I recognize a hand from Daniel Bamukama. But before he comes in, Philip, there's also a request from the member countries that would the Malawi team be able to share the full behavior matrix and the archetype with the group? You'll be able to do that, isn't it?
Yes,
okay.
Yes, we can share with the team the archetypes and also the behavior matrix for all the target audiences we work on. And depending on if people, depending on the level of clarity they will need, it's possible to also arrange for separate kind of calls whereby we can talk through and be able to clarify areas they may not fully understand. But yes, that can be shared. Thank you.
Okay, thank you so much. Now over to you, Daniel Bamukama. I hope I've pronounced your surname correctly. Over to you, the floor is yours.
Thank you, Chair. Thank you, Team Malawi. I'm Daniel Bamukama from Uganda. With a campaign, I would imagine that you create demand. People want this service. So one challenge we have in Uganda is that the condom at the health facility really does not play a big role in HIV prevention. There are so many barriers accessing the HIV, the condom at health facility. I know the distribution of health facilities in Malawi may be different from Uganda, and maybe the cultures, but in Uganda there is really a challenge. So we come up with innovations of making these condoms accessible at community level. We use condom dispensers, we encourage hotels to, I would want the Malawi team to share with us your condom distribution model. I may have missed it because I was having poor network. How would you get the condom to the people, somebody in Kinamwali? How do they get the condom without really going to a health facility on a Sunday or at night? How do you ensure the people you have mobilized have the condom and consistently and regularly? Secondly, I would assume maybe you have done like your demographic health survey. Have you gotten any new statistics regarding the performance of the condom on the condom in the condom use indicators? Can you kind of share with us the improvement so that we see the immediate impacts of this innovation? Thank you.
Thank you so much, Daniel, for those two questions. And any other hands so that we can answer the questions together? So please, Daniel, remember to remove the raised hand. Otherwise, I'll think that you are putting up again. If you can lower your hand.
I will.
Thank you so much. Any other observation questions to the presenters before we can respond to what Daniel has asked? I'm not seeing any hands. I take it most of the questions were already asked in the chat box. Let me see, I'm seeing a new chat. Let me see. Oh yeah, it says, does Malawi have an evaluation framework to help measure the success or otherwise of this condom communication model? Yeah, I think that's this. Let me just check if there are any other. Yeah. So there's an additional question that does Malawi have an evaluation? Hello?
Dr. Mwansambo, request, allow me to pose a third question. Can you
give
us
a
picture of what proportion of condom distribution is done through your community health worker? You have a vibrant community health worker system. What proportion would you say of the condoms accessed by the Malawian are through the hands of the community health worker?
Through community health workers. Okay. Okay. Yeah. So then any other last questions? Okay, so Philip, there are some questions that you could respond, but some are for James. Maybe at this point, maybe if you could, if Philip, if the questions that were raised, if there's some, but I think most of them will be James. So James,
Yeah,
can you now take
let me
over?
start. Dr. Mwansambo, let me start, and then I think James will come in. I think there are
Okay.
questions I can also respond to. Thank you.
Okay, go ahead, respond, and then James can come in to finish up the rest. Over to you.
Thank you. Yes, so thanks for, I'll start with a question, a comment from the colleague from Uganda when he talked about challenges with this standard distribution systems for condoms. I'll say the challenges, I would say, are universal. They're not just unique for Uganda. We also noted a few challenges with the regard to pushing condoms from the traditional distribution systems. So yes, James earlier on talked about the last mile kind initiative. This is an initiative where we are trying to help push condoms beyond the health facility. So in the slides James shared, we're saying 68% of the condoms being distributed in Malawi are through the public sector. And within the public sector, we noted that about 62, a huge percentage are through the health facility. I'm just trying to recall the percentage. It's through the health facilities. We noted that, yes, we've got there like non-traditional distribution systems or spots or places within the community, but in some cases they are not fully utilized. So through the last mile initiative, we're trying to promote that. And it will prove, for example, you've talked about using condom dispensers, non-human dispensers, which also aligns with the COVID situation, because we know the stigma which is being attached to the health facility, whereby one would think they'll contract COVID at the health facility and they may not feel comfortable to go and access condoms at that place. So we're trying to move condoms beyond the health facility and into other non-traditional distribution points within the community to help increase access. So that's something which it's an initiative which is also fully fledged, and there's a team working on that. In terms of the metrics, yes, for condom use, the good thing with condom use, there are quite a number of standard indicators. I know we've got colleagues from UNFPA. UNFPA has done a good job in terms of customizing the indicators to help with tracking condom use. Some of them like proxy means of assessing condom use. So we've adopted some of those indicators. We have them and we'll be able to evaluate, assess the impact of this initiative in terms of overall uptake of condoms for the different population groups. So I may not recall all the indicators, but there's a package in terms of standard indicators. And in the document which we worked on, we've also clearly outlined which indicators are these, which will be tracked over time and be able to assess the impact of the intervention. So that also answers the question to do with the framework for evaluation. So okay, yes, at the end of the campaign, we need to evaluate. So there are key questions we are asking. One, in terms of the approach, the intervention itself. Was it effective? Which approach proved to be more effective? For sure, not every approach will be effective. We may realize that social media helped a lot. Maybe the IPC did a good job with the female condoms as we continue learning. Maybe engaging men in places where they interact, for example, where they watch football and the like, proved to be effective. All that will be part of the evaluation package and be able to document and share lessons for scale up and also for others to adopt as they implement this initiative. Thank you. I think, James, I don't know if what I've left, if there's something to add, feel free to add. Over.
Yes, James, maybe the issue also of the DHS. The issue of the DHS, do we have new statistics to indicate any impact of the campaign? Over.
As I said during my presentation, the last demographic and health survey was done in 2015-2016. So we haven't done any evaluation up to this year, but we are hoping that by next year, another DHS will be done, which will now evaluate the period between 2015 to now. So this campaign is being conducted within this period that hasn't been evaluated. So we are hoping that by the time we do the next evaluation, the next survey, we'll see a great improvement in terms of condom uptake and condom use. Thank you.
Thank you so much, Philip and James, for those comprehensive responses. At this point, from participating countries, are there any more questions? I'm not seeing any raised hands, and there are no more questions in the chat box. Should I take it that we have you have exhausted the questions, comments that you had for the Malawi presentation? Because indeed, as you can even note, in the time that we had allocated, we have even gone beyond, and this is just to show that this is indeed a very important topic. And maybe for the Secretariat, you can just take note that maybe, I don't know the time allocated, whether it's enough. If you have noticed, even our presentation as a country, we had left out a number of things because we were trying to fit it into the time, and we left out a lot of stuff, and then they were just exposed as the participating countries were asking the questions, and it seemed as if we are not implementing those things in our program. It's just that we had to see which things can we include in the presentation and which things can we leave out. So since looking at the, if I'm not mistaken, this is the first session, the first kind of link and learn session for countries, if I'm not mistaken. So already maybe this South to South Learning Network Secretariat are learning lesson to this in terms of maybe the time allocated, so that the countries can present comprehensively, and also other participating countries can have enough time to ask questions and then have learn lessons from. Because looking at the time, we're almost getting to the end of the time that was allocated, about 1.5 hours, and we still have the agenda. We haven't finished the agenda because the next item on the agenda is like we needed to now a summary of commitments and next steps, where participating countries need to share their own takeaways from this presentation, or from what Malawi has presented. Of course, some of the issues were already shared in the chat box. So now the floor is open to participating countries based on the discussions, the questions, the presentation that Malawi has had, and would like to hear in this order the countries to share what are your takeaway from this discussion. We can start with Ghana. I think it may be 2-3 minutes. You can just share with us what is your takeaway from the discussion, the presentation, Malawi presentation today. And also after Ghana, then Uganda, then Nigeria, and Zambia, in that order. Over. Just 2 minutes or 3 minutes, just to quickly, just your takeaway from this. And just to mention that we'll share the presentations, the recordings, and any other supplementary documents that you have requested in the chat box, we'll share with the participating countries. I'm not seeing any hands. Should we take that? Your takeaways were already included in the questions, comments but it would be just nice just to hear 2 minutes or 1 minute, 2 minutes for each country. What is your takeaway from this session, that considering that this is the first session in this category where Malawi has hosted, and then the next will be other countries hosting other sessions?
Maybe from Ghana. I joined a bit late, but it was a very informative presentation. All the issues about the condom mass, the SBCC campaigns, and then our issues was also around the emphasis on abstinence, which I saw that Mr. Amenya from Nigeria had already posted. That's why we didn't have our hands raised, because it plays a very important role also in HIV programming. So thank you so much, Malawi, for that insightful presentation. Over, thanks.
Thank you so much, and we have taken note. I will also ensure that we strengthen abstinence into our campaigns. You are very right, so that our young people also, we need also to support them in that and work with the religious leaders at it, as it has already been recommended in the chat box. Thank you, Ghana. Can I now request Uganda? Uganda, 1 or 2 minutes, just your summary of your takeaway from these discussions. Over to you. Uganda.
Dan?
Have we lost Uganda? Oh, here, yeah, Rosemary.
Yes, I was calling on my team lead, Danny. I don't know why he's not responding. No, I from my side, this is great learning. I've been in condom programming for many years, and getting to organize such a massive SBCC campaign has eluded us, if I may say, because most of our funding sources usually say that's toxic kind of intervention. It will be difficult to measure your result and your impact and so on. And perhaps what may have not come out clearly is how, if you still have social marketing programs in Malawi, how this works with them, because we've overly relied on that other than having a stakeholder-led kind of intervention. So it's great learning, and perhaps we will need some session again to learn from how this is progressing and how this can be sustained, especially considering that you have cohorts of children who are becoming adolescents and sexually active. So it is something you need to continue doing, and we need to learn from how that has been managed. Otherwise, we look forward to more support when we reach such points, and we need technical support from Malawi to look maybe into our documents if that is possible. Over to you.
Thank you so much, Uganda, for that. Indeed, you've taken note of the issues that you have raised, and for sure, that's the whole purpose of having this link and learning sessions, so that we can support each other's countries, because even though as we have presented on this condom demand creation, we also have areas where we have weaknesses which we'll learn from other countries like you. So indeed, we have taken note of that, and this is one thing that I would like at the very end to ask the South to South Learning Network so that they can tell us more on the next steps, because indeed that was the whole purpose of having this session, so that countries can learn from each other and then provide and help each other and provide the technical support where that country needs it. So for sure, that's a yes from us as NAC. Sorry, I'm used to saying that because I'm from Malawi. From Malawi, so that when you reach that stage as Uganda, then definitely for sure Malawi will be able to provide that needed technical support. Then now can I ask Nigeria, your 1 or 2 minutes take away from this? And already I can see in the chat that indeed we need at least 2 hours of this session. 1.5 is not enough. So anyway, Malawi was like a guinea pig we're starting. So the Secretariat will modify based on the experience of today's meeting. Nigeria, please.
Anyway, good morning, colleagues. Really, I was waiting for my team from NACA, but since the platform is quiet, I will just jump in to say a very big thank you to Team Malawi. I think they've done a wonderful job in terms of making a clear case for strengthening strategic behavior communication around condoms, because as Rosemary said from Uganda, investment into communication has not been really very strong from the different sources of funding that we have in the HIV program. And I think this example from Malawi has been very thorough, has used clear data and approaches to really make a strong case as to how to segment different target groups within the population to influence condom uptake within their HIV program. And I think that the processes that they have used really has been insightful for Team Nigeria. And I also am happy about the fact that they are prepared to share their documents, which will help us to also think along the same line, because the condom need here in Nigeria is so huge, and we think that for us to be successful, we definitely need to have clear communication strategies to promote AIDS condom use. The change in incidence in Nigeria over the past 10 years has just been about 13%. And we think that condom has a big role to play in order to help Nigeria further reduce its HIV incidence. And so thank you so much, Team Malawi, for making this exciting presentation and sharing your experiences. And we hope we would also learn from you. Thank you so much.
Thank you so much, Nigeria, for that. And indeed, we're happy to hear this. And as this is just the beginning, I'm sure as we go along, we'll be learning more from each other. Now, can I request Zambia? Zambia, can you share us 1 or 2 minutes of your takeaway from these discussions? Zambia, please. Have we lost Zambia?
Hello, we are here.
Okay, great. Over to you. The floor is yours.
Yes, I'm hoping Dr. Mwansambo can give feedback because he's on the call.
Yes, go ahead.
Martin, I joined late. I have also noticed Dr. Tsenga has also joined, but she must have also joined late. So since you were on earlier than us, it doesn't hurt. You can summarize on our behalf, Martin. Thank you.
Okay, thank you so much, Dr. Mwansambo. I think for me, my take home is on the CSO input and as well as the last mile approach in terms of ensuring that the condoms reach the intended beneficiaries at community level. So most of the strategies that's shared, we relate to them. And I think kudos to the Malawian team in the strategies that they've deployed and shared.
Okay, thank you so much. Thank you so much, Zambia. I don't know, maybe I need also to give an opportunity to my fellow countrymen, James and Philip. Is there anything you want to say, 1 or 2 minutes, as the host country, but as presenters, and based on the questions and and comments that the participating countries gave to you, so that I should also give you an opportunity. Starting with Philip and then James.
Yeah, thanks, Dr. Mwansambo. Yeah, thanks. I think it was a very good discussion. I like the questions, and it's an eye-opener on a number of things. I like one comment whereby somebody highlighted that we've noted significant decrease in SBCC, condom SBCC in a number of countries. I think it also it's up to this group to start lobbying for that. because we really need strong condom SPCC to promote condom use across the board. So it was a very good discussion, and looking for more discussions in a number of health areas that this initiative has lined up. Thank you.
Thank you so much, Philip. James?
Yeah. I think that's good. It has been a good experience. And we have learned a lot from the feedback from our colleagues from other countries. On the issue of use of data, I think that one will emphasize more as we develop the intervention strategy, of which condoms will also be a key intervention in the strategy. And also, as we are developing or finalizing our strategy on last mile condom distribution, we have learned a lot from the feedback that will incorporate in that document. Thank you.
Thank you so much, James. I think at this point, before I officially close the meeting, I would like to call upon the South to South Learning Network Secretariat just to highlight to us what are the next steps, because this was the first link and learn session that Malawi has hosted. What are the next steps before I come in to just summarize and close the meeting? Over to Secretariat.
Thank you very much, Dr. Mwansambo. And yeah, just to appreciate you specifically and the Malawi country team. I know you mentioned that this was our first Link and Learn session, and I think we do have many takeaways. So I just want to thank you so much for the feedback. In terms of the support that we would like to provide moving forward, I think the key space that the South-South Learning Network Secretariat sees themselves playing is to help facilitate you know, a continuation of some of the discussions that have started here. So I think there are a number of things that we're able to provide to the host and participating countries. The first is that we will most certainly make sure that all relevant documents are shared, and also that the contact details are shared of the participants who are in the country. I think we don't want to be seen as a barrier to direct communication and countries reaching out to one another. And so we can share contact details if there are particular discussions that anyone would like to follow up. Having said that, we recognize that sometimes it can be difficult to find the time to set up further engagements. And so most certainly, I would like to volunteer the South-South Learning Network team to support any follow-up engagements that anyone would like. I think Uganda specifically highlighted that they may want to engage Malawi a little bit further on how social behavior change communication intersects with social marketing, and other members on the team might in fact also wish to have a follow-up call. And we are very open and available to trying to set that up for colleagues on the call. Something else that we have noted during this session is that there are a number of themes and gaps that seem to have emerged that colleagues are interested in. And so we'll feed this back into the greater learning agenda of the South-South Learning Network and identify if those themes have come up in other Link and Learn sessions or webinars for that matter, or if they're going to be documented by any other country. I think if it's a specific gap that doesn't exist anywhere in the learning agenda, we can certainly try to fill that gap and see if we're able to arrange a session to continue that discussion. And then just to say, we would really like to support Malawi in further documenting this Link and Learn session in the form of some sort of written document that can also then be shared with countries, because it seems to be a wonderful, promising practice. And as you mentioned, there may not have been sufficient time to engage in a lot of detail. So I would also like to offer that to yourself and Philip and James and the rest of the Malawi team. So I think practically those are some of the next steps that we can take to continue the discussion, but we're also most welcome for anyone to engage with us if anyone has additional requests or asks around this particular topic. So thank you, Dr. Mwansambo, back to you.
Thank you so much, Kerry, for those next steps. And indeed, it has clarified some of the gray areas. And I take it that you also share the report of this meeting with all countries. And what we'll do as Malawi, we'll submit to you all the presentations and all the other documents so that you share with all the countries. Otherwise, at this point, unless there's anyone else who has any burning issue from participating countries, otherwise, it's like we've come to the end of the meeting. Let me say that I'm pleased on behalf of the Malawi team that our presentation has indeed triggered more discussions and also exposed some gaps that indeed the Secretariat will take further so that we can discuss on those issues and see how we move forward on those ones. And I'm pleased also to note that I think the objective of this meeting has really been met, and we are satisfied as a country being the first meeting that it has gone well. So let me take this opportunity to thank the participating countries, Ghana, Uganda, Nigeria, Zambia, and my fellow Malawi, and also the Secretariat for making this meeting possible. And we have started well, so we're looking forward to other meetings that will be coming as we move forward. And indeed, some of the issues that have been identified that needs further follow-up, we are hoping that and relying on the Secretariat to coordinate us as countries so that we can continue learning from each other, so that at least where we need to provide technical support or where we need to receive some support, we can be able to do so. So thank you so much for being a wonderful audience and for participating actively. And also last but not least, let me thank my colleagues from Malawi, James Njobvuyalema and also Philip Mkandawire for making those comprehensive presentation that have made us have very fruitful discussions. And we're hoping that moving forward, we'll achieve even more as countries together. Thank you so much, and I wish you a wonderful day, and may God bless us all. Thank you.
Thank you. Bye-bye.
Bye. Thank you.
Thanks, Malawi. Bye-bye.
Bye.
Bye, everyone.
Bye.